Yes, hello, everybody. Um, Good evening, ladies and gentlemen. It is my great pleasure to welcome you all on the first anniversary event of Shake, Saving Heart Attacks Key Efforts. Shake was launched on 25th Jan 2020 under the patronage of Dr. Azad Mupin, with Dr. Brajesh Mittal being the founder chairman. Today's activity is oriented towards the most burning and relevant topic of the current time, that is, the COVID vaccines. Everybody is intrigued, and there are more queries than there are available answers. Amongst us today, we are proud to have Dr. Azad Mupin, Chairman and Managing Director of Aster DM Healthcare Group, who is also the patron of SHAKE. Dr. Brajesh Mittal is a well known cardiologist in the region. He is the Deputy Medical Director and Head of Cardiology Department in Medcare Hospital, Dubai. It is on his initiative that this specific talk is even made possible for the large interest of the society. We have also invited two panelists who are astounding physicians with vast experience and knowledge. I would like to introduce Dr. an accomplished physician who started her practice in California and then returned to India in 2004. Dr. Chavi has been a frontline worker in COVID times, a survivor herself, and has helped approx 300 patients of COVID to recover by designing and implementing home based COVID care services. Dr. Ajit Jain is yet another COVID warrior. He is a nodal officer for COVID 19 New Delhi. He has been recognized by the President of India and Chief Minister of Delhi for his exemplary contribution and relentless efforts. He has also established the first post COVID clinic in India. With these introductions, I would like to request Sir Azad Mupin to give his insightful and aspiring speech.
Yeah, thank you. Thank you very much for this opportunity. First of all, I must place on record as one of the patrons of Sheikh, the greatest appreciation I have for a person. We many times hear one-man army, and Dr. Brajesh Mittal is the real one-man army that I have seen, real life example of a one-man army who has taken up a task and who has relentlessly, done activities to inspire people and to carry forward the mission of educating people. Of course, he is one among the best cardiologists and best doctors that we have in Dubai or in UAE. And apart from his clinical skills, professional skills, he has been focused on how to help people, how to support them by educating them. That has been his life's mission. So I really appreciate the efforts that he has put in the last maybe 15 years that I know him. And this is a specific project which he has taken up. And when I say single one-man army or single-man army, it really means a lot because it requires a lot of grit and determination to do things continuously. We all know that we can do once, we can do twice, but when it comes to doing it continuously. For last 1 year, he had 4 programs, and this is the 4th program, including the inauguration. So that is something which really tells us the ability for him to perceive things, and the perseverance is something which really appreciate. So congratulations, Dr. Mittal, Brajesh, we
Thank you,
call
sir.
him, and you have made us proud. He's a
Thank you, sir.
colleague. We work together, even though I don't practice nowadays, we are together, and he is part of our team. Now, coming to the subject which he has chosen, there is no more appropriate subject than this for us to do now. We are all in the midst of this pandemic, which started 1 year back, or even now it is going to be more than 1 year, 1 year and 3 months. And this sinister monster virus has hit the whole world and killed millions and affected even maybe largest number of that we have seen in the recent past. 100 years is what they say. What we had last was in 1918, the Spanish flu, and then we are, after 100 years, we are getting this, and it's not yet over. We were talking about 1 year back when we launched Shake, we were telling about before and after COVID. Now that whole thing is gone. We talk about living with COVID, which is a reality like what influenza is. We have to live with that. Every year it comes and goes. We don't say before influenza and after influenza. Like that, this is also going to be there, and we'll have to now, study how to live with that. So that's a reality. And then we have to adjust to that. It is not only the medical profession, everybody, they have to adjust with how to live with the pandemic. So the two areas which are chosen today, one is the myths about the COVID-19 and the vaccination. Both are very important. The myths many times, no, it really, produces issues. People think about a lot of things. For example, people think that heat is good for to prevent, and cold is not like that. So that is one of the myths which people have. Supplements help. I'm not saying that supplements won't help, but how much it is going to be helpful. A lot of things. Then antibiotics. People think that antibiotics are very useful in COVID. Whereas what we have found is that in the last 1 year, after many trials and all, the only thing probably is useful in case of as a medicine is dexamethasone, a steroid, which will reduce or which will definitely help in controlling the moderate to severe cases. So there are a lot of myths around that, and this has to be busted. And that's what Dr. Brajesh and the panelists are trying to do today. Now, the other subject being chosen today is vaccination. This definitely is the light at the end of the tunnel. There is no doubt about that. And again, here there is a requirement for making the public aware about what actually is are there any side effects? Is it safe to take? And which vaccine to take? There are a lot of things which have to be cleared. Before I go into that, I'm not even planning to take that up. What I want to just do is to congratulate the visionary rulers of UAE who made the vaccines available to the people, and they are planning to cover 50% of the population within 3 to 4 months, which will, we hope, give herd immunity and allow the whole life to come back to near normal. In India also, we have done fantastically well. We have been able to be the pharmacy for the world, and we have been able to produce in large quantities the vaccine, and we are supplying it to the neighboring countries. This is such a proud moment for all Indians when we look at we being able to provide this at very economical cost to the whole world. So that is something which makes us all of us proud, and this is something which is going to help us to contain this pandemic. Before I conclude, I just want to just uh, touch upon one point which is beyond vaccination. So somebody was talking to me recently, and we were discussing, and we thought that, see, vaccinating the whole world, which is 7 billion people, and at least half or 60% of that to get an immunity against this virus. And the next part is that even if you vaccinate, the next wave of this coming with some mutation, you are not going to protect the people. So this is like what I said earlier, is going to be continuously a process like in the case of influenza. So is it something tenable? I don't think it is. World over, maybe some of the countries may be able to do that, but most of the world, which is in abject poverty or can't afford or can't have the cold chain. There are a lot of things which restrict vaccination. So what is possible? So I think that instead of carpeting the whole world, can we wear a soft shoe and walk around? And what is that? The way in which this can be achieved, according to me, is to get a medicine which is effective. Because we all know that only 5% of the people who are affected by the COVID-19 virus has got moderate to severe illness. And only 1 or 2% of them even go into a ventilator, or very few die when you look at the overall population that is affected. So in such a situation, instead of covering 100% of the people population, can you have something where the 1 or 2 or maximum 5% who are having the severe, moderate to severe illness, can they be given this medicine which is going to be effective, like an antibiotic against a particular disease? We don't have anything now. We just give remdesivir, or we give dexamethasone or other medications which are supportive, or many times it has not proven that it is quite effective to completely, to even touch the tips of curing of the COVID-19. So the way in which this is going is that we have to get a medicine which will give us a lot of confidence, much more than the vaccine. That's what I feel. And this has happened in many other illnesses. Tamiflu, for example, is an example where we feel much more comfortable when we are dealing with the virus. So that trial is going on world over. Like the vaccine, which in itself is a huge thing. Vaccine, if you look at, usually takes 5 to 10 years to develop a vaccine and bring it to the market. Here, in just 1 year, less than a year, we get a vaccine, which is greatest achievement of the scientists world over. We are extremely happy. And there are 240 trials going on worldwide to get a medicine for against COVID, or to repurpose some of the existing medicines. That, I think, will be the end of the pandemic, or at least a semicolon to the pandemic. So let us hope that in this year, we will find effective medicines coming up for treating moderate to severe cases, which will allow us to breathe a sigh of relief. With that, let me congratulate the Dr. Brajesh, and along with him, the two panelists, Dr. Mehra and Dr. Jain, who are participating, who themselves are COVID survivors. Dr. Jain is actually a COVID warrior recognized by the government of India. And I congratulate them and thank them for being on the panel today for discussing with you. And I also thank all of you for participation. So thank you, Dr. Brajesh Mittal and the team, and may God bless you for doing this. Let us all remain or stay positive regarding COVID, but at the same time, test negative. So that is my message to you. Thank you very much.
Yeah. Thank you very much, sir. I am humbled by your kind words towards me, as always, as well as your inspiring and thoughtful, uh, all the points which you raised about the COVID and the vaccine and the current situation. So, who says that you are not a practicing physician? You know more than a routine practicing physician whom I know on an average basis. So, you are keeping yourself very much up to date, and your insights and thoughts are added with the experience which you carry for last 30 to 40 years of seeing the world in different ways in different phases. We are so much honored to have you here, sir. I know how busy you are in most of the activities, philanthropic, entrepreneurship, so many different aspects of your life. So thank you very much for being with us. Uh, I will start the main part now for the lecture, and with your permission, sir, I'll go forward with my presentation. Good evening, ladies and gentlemen. This is my great pleasure and honor to have you all here and sharing the knowledge. I don't say I'm imparting the knowledge, I'm sharing the knowledge with all of you. And with me is one of the panelists present out of two, Dr. Chavi, and she will be interacting time and again. The other panelists have unfortunately could not join for some official and personal reasons and compulsions. So the topic is very, very relevant. The conquering COVID-19, the myths and facts of COVID vaccine. So first of all, I want to bring to your notice that my presentation is not based on anything coming from WhatsApp or Facebook or Twitter or Google or neighbors or gossip mongers or newspapers or TV. That's not what is my idea. And this is also hardly any of my personal thought. Whatever I'm going to discuss and whatever I'm to give you an insight is mostly based on the scientific resources with some logical explanations from my side and interpretation from my side. But these are not my original thoughts, neither from the social media. So I am thankful to the resources which I used, FDA of USA, the World Health Organization, Center for Disease Communication from USA, and New England Journal of Medicine and Lancet. These are some of the resources which I use. So a quick recap of what we know about COVID-19. COVID-19 is an infection with SARS-CoV-2, the virus that causes COVID-19. And the real trouble with this virus is that this can result in a range of illnesses from mild symptoms to severe illness and death, and even asymptomatic. So it's a very, very large range, a big spectrum from being almost no asymptomatic until the death. Anything can happen. We don't know how SARS-CoV-2 will affect each person, and a given person who gets infected, we cannot predict that what course his body will take, in what spectrum of the disease he will fall. We know that some people are more likely than others to become severely ill, such as older adults or people with certain medical conditions. So, how to prevent COVID 19? Again, a quick recap of the various measures which we have prescribed and time and again. Wear a mask that covers your mouth and nose. Avoid close contact with others. Stay at least 6 feet, in other words, about 2 arms length from other people. Avoid touching your eyes, nose, and mouth with unwashed hands. Clean and disinfect frequently touched surfaces daily. Wash hands often with soap and water, and if soap and water are not easily accessible, one can use an alcohol-based sanitizer of 60% saturation of alcohol. So adding to the layers of prevention, the next layer is the vaccine. And as of now, there are multiple COVID-19 vaccines which are in development, several of which are in large scale trials. Some of them have completed phase 3 trials, and some of them are undergoing phase 3 trials. And at least 150 more vaccines are in the phase 1 trial or preclinical trials. So FDA emergency use authorization does not mean that it has to be given to emergency patients. It means that in an emergency phase, there is a quicker process of authorization for the use of a given medication or a given vaccine. So FDA did some emergency use authorization, followed by several, and I will say most of the other countries who also fell in the line, and they also gave emergency use authorization of the vaccines. Although the emergency use authorization word has been used and it has been a faster and quicker process to authorize, yet they have undergone through the same safety standards. And this is not, we can't say that the bodies and organizations have in any way cut short the process or they put the safety at stake. So how do the vaccines work? What do you mean by a vaccine? When somebody suffers naturally, the body makes antibodies, and that is what we call immunity. The same kind of immunity, if we can provide artificially, then we call it a vaccine. So, how you can create the immunity in a person. You can give that person a whole virus or a bacterium which is either killed or deactivated. You can take out a part of the virus and then you inject that, or you supply that, or you give uh, that part, and that then induces the immunity. Or you just use some genetic material which creates the immunity. So there are some different ways, and the current vaccines fall into one of these groups, uh, either of the killed vaccine or inactivated virus, or genetic material or a part of the virus. So these are the vaccines which you might have heard recently in last couple of months, which are available, which are being used in the world. So we can group them into three different kinds of vaccines. There are two from USA, Pfizer, BioNTech, and Moderna. Then there are two from uh, India and China, which are Sinopharm, Sinovac, Covaxin. So Sinopharm is made in China and tested also in UAE. The Sinovac is tested in Thailand. Covaxin is being developed by ICMR and Bharat Biotech. Then Sputnik is from Russia, and Covishield is from UK and India. You would notice that I have grouped them in colors. So these two vaccines are of one particular type, these two are another type, and these two are third type. So let's see, what does it mean? What are the types of these vaccines? If you size up the shots, so these are the ones which are commonly available now. The Sinovac, or a counterpart is Sinopharm. Then from Oxford University, AstraZeneca, and the same methodology is being used in India to produce this vaccine in large amount. Then Moderna and Pfizer BioNTech from USA, then Sputnik from Russia. So these three major classes of vaccines which I enumerated are, the two of them are Moderna and Pfizer BioNTech vaccines, which are made in USA. These are the specific vaccines used. They are prepared by using the messenger RNA. This is a very unique kind of vaccine, and this kind of vaccine is available for the first time, although the trials of making an mRNA vaccine have been in the progress from many years and many decades, but a real vaccine which has been used for this purpose is available now. So the messenger RNA, what it does, that it enters in the body, in the cell when you inject it, and it gives an instruction to create a protein similar to the one which is carried by the virus. So this artificially created protein then creates an antibody response which is applicable and which is active against the actual viral protein and actual virus. So this is one way of making the vaccines. This is a unique way. This is the first time it has happened. And this is a very fast way of production of the vaccine and a very simple way of production as per the scientists. Then the second group of vaccines which are available now are the inactivated vaccine, where the virus is killed by heat or by the chemical substances. And such vaccines are from, you will hear, are Sinovac and Sinopharm and Bharat Biotech. So the actual virus is killed. So it is no more able to give an infection, but it still contains that part of the protein which can create the antibody. So that virus injected, it cannot replicate, but it can provoke a host immune response. Then the third variety of vaccines which are currently available are the vector vaccines, in which the material from the coronavirus is extracted out and it is put in a harmless vector or harmless virus. And that is then injected. So thereby somehow you get this material into the body of the person, and then it creates the immune response. So such examples are our Oxford AstraZeneca and Sputnik, and even from Janssen. So this is just a very basic and simplistic form of demonstrating that how the vaccines work and how are they made. Now the real issue comes, doctor, can I take the vaccine? This is a real trouble. Every patient has this question. Uniquely, interestingly, in last few months, we have seen this very specific phenomena. To start with, people were all worried when the virus came and the infection was at its peak. when are we going to get the injection? When are we going to get the vaccine? Everybody was asking for the vaccine. There was a lot of urgency in the minds of the people. And when the actually vaccine came, then people started thinking two ways: yes, no, whether I should or I should not. And that resulted in a hesitancy. So, why it happened? Because for few reasons, because we are not well informed, we are not fully aware what is happening, we have been fed wrongly by the media, by the colleagues, by the people. Like for any other medicine in the medical field, there are always ifs and buts and doubts and uh, risks which people think of without any rationale. So this is how this situation came. There is urgency as well as there is a hesitancy in taking the vaccination. So we will try to answer the questions. And doctor, can I take the vaccine? So I would ask my co-panelist, Dr. Chavi, also to interact, and I will put forth a number of questions which we'll keep answering and which will be, these questions are actually the questions which are in your minds. You all are actually having these doubts and these similar questions. So first we will try to answer, we will put the question as well as we will answer them. And subsequently, we will also have some questions from you, which you can type in your chat box. So the first question is the vaccination safe? So dear friends, the available vaccines are very, very safe. They have been given to millions of people worldwide, and there are no safety issues, there are no safety concerns for the vaccines which are available. Nothing is 100% safe in medical sciences. They are as safe as anything can be, and we can clearly conclude that they are safe to take. The second question is, are they effective? So the answer to this question is yes, they are effective. The available current vaccines have been tested. The US vaccines have shown an efficacy up to 95% over 8 weeks. And then we don't have a long-term trial, but yes, they started. The trial was started in the summer, and the vaccines were approved on 11th December and 18th December, respectively, for 2 vaccines in USA. And the AstraZeneca Oxford vaccine effectivity has been shown to be 75 to 80% in the trials. Same applies to Sinopharm. It was shown 89%, and then it also been shown somewhat differently to 79%. So they are safe, and to a large extent, they are effective. So the next question is, which one should I take? Dr. Chavi, can you join us and can you give your insights about the available vaccines and which one should take, which patient should take what and what should be preferred?
Could we, open my video, please? Because it's not allowing me
Yes.
to.
One
And
moment,
the
please.
video.
Sorry.
Yeah. No problem.
Okay. One. Sorry.
I think just the video. Anyway, I'll answer the
1
question.
second.
We can open the video later.
Yes. In the meantime, I'll open the video. Yes.
Yeah. So which one to take? Most of the time, what I know as of now is we are not having a choice here. I think we have been given a vaccine. So as Brajesh, Dr. Mittal has been telling you in the past slides that there's an mRNA, the two of them are there, the Pfizer and the Moderna, and then we have the viral vector ones, and then we have the dead viral vaccines, which are basically the covaxins. So whatever has all three of them are actually found to be quite safe. Covaxin still is having its third clinical trial going on, and the results should be out in Feb. But the emergency utilization of vaccinations have allowed Covaxin to be utilized in certain cases, which is being utilized in certain parts of India. So whatever of the three vaccines that has been offered to you has a good safety profile. We can go deeper into the safety profile. And And all CDC and ICMR in India and the European Union, they have all guidelines of who should not take these vaccines. So according to me, all three of them are safe, and do study the guides that who should not take these vaccines. There is a clear-cut guideline, and I would recommend taking any and whichever one that has been offered to you.
Good. Thank you so much. You can also open your video now.
Okay.
So next question also, Shavika, you can take over. What are the side effects? Because
Yes,
people are
the
afraid
most
of the side effects.
Yes, yes. I know that a lot of news media and a lot of panic-ridden results have been reported from various places with since the vaccines have started. And I think a lot of it is anxiety and a lot of it is sensationalization. And we're getting more and more confidence in the safety of these vaccinations as time is going by. The data and analyzed data will be coming in the second quarter of 2021 around the world with the vaccination, more and more number of people getting it. So just to the side effects in general, when you take the vaccine, of course, the soreness at the site of the vaccination, body aches, low-grade fever, and fatigue. These are another, and maybe some headache. These are the most common side effects that have been witnessed with the vaccine. There have been few cases of allergic reactions and anaphylaxis, and there have been proper reported warnings of who should not take, who've had prior anaphylaxis. There has been a clear description of all the ingredients that are present in each vaccine. And you need to know, you can ask your doctors if any of those ingredients have ever had a reaction with you in the past. They do not, they're not made out of any animal medium like eggs. So these vaccines are 100% safe where somebody has egg allergy. But if there is any anaphylaxis or even moderate allergic reaction to the first, which is half dose mostly, then we do not want to give them the second dose. So the side effects commonly are just body ache, fever, headache, soreness at the site, and it usually does not last more than a day or two.
Okay, thank you. There are some media reports of people suffering from facial palsy and some more side effects. Are you convinced
yes.
with that report?
No, I'm not convinced it, because recently there was a complete analysis done on the 4 cases of Bell's palsy when this vaccination was started, the Pfizer was started in UK. And they actually studied it and they found out that the number of people that were vaccinated and the Bell's palsy, which happened to 4 of the people, was equivalent to the occurrence of Bell's palsy in a common scenario. So they have taken that off any warning or in all on the academic media, not the news media. So no, I'm not convinced with Bell's palsy as well. Yeah.
Okay, thank you so much for your comment. What precautions should I take? This is a question from the patients before going for the vaccine. So the answer is yes, please. Yes, continue.
Go ahead. No, go ahead.
Okay. So the answer is there are no specific precautions. You should at least once discuss with your family physician or your treating physician if you're already on some medications or if you're known to have allergies. In general, there is nothing which is going to forbid you or going to prevent you from taking in a jab as far as possible in the current scenario and the common scenarios. Abnormal situations, uncommon scenarios may be there. And the next question is, which is very common to me from my patients because they are always on multiple medications. So should I stop any existing medicine? So my answer is very clear. Do not stop any of your existing medication. You should continue all your routine medications, your given medicines. There is no need absolutely to stop anything. There is very interesting question that some people are afraid of pain at the vaccination site. So can I take painkillers before going for a shot? Now, interestingly, the answer is no. We do not suggest you to take pain-killing medications prior to the jab or prior to the vaccine, because some trials have shown that vaccine effects becomes reduced if you take an analgesic or a Panadol-like tablet before the vaccine. After the vaccine, if you develop a soreness and pain and inflammation at the site of the injection, then certainly you can take the medication as per the requirement. Do you agree, Chavi?
Yes, absolutely. It is true that
Yes.
we might affect the efficacy. Yeah.
True. So next question is, Doctor, I have already suffered COVID infection. Should I still take the vaccine? The answer is yes. If you have suffered and recovered well, you can and you should take the vaccine, because as of now, we do not know that your natural immunity will last how long, and will it be sufficient? Will it be enough? And people do suffer from the second infections. We have seen people suffering from second infections. So even if you have been a patient who have already suffered COVID infection, you can very well go ahead and take the vaccine for your future care. Yes.
Yeah. Can I add something
Yes,
to that?
yes. Yes.
So people who are COVID survivors, as of now, as the medical data, as of now, says that your immunity, they safely say, will definitely last for 3 months. There have no known cases of reoccurrence 3 months post survival. So anybody definitely, and we don't have any scientific data on your immunity for COVID 3 months post your first infection. So there is still, they're only claiming that you're safe for 3 months and not more than that. So 12 weeks after your first infection, if you've been 12 weeks away from it, you should take COVID vaccine. And there's another addition is that up to about 8 weeks post your infection, your immune system is building up antibody for. But after 8 weeks onwards, you're perfectly safe to take the COVID vaccine.
Good, thank you. I may like to add here that this is a correct advice of 3 months. Yet, if you are completely recovered even a month before and you are offered a vaccine, you can still take it. There is no contraindication to that, and there is no harm of doing that. So next question is, now this is a different scenario. Some patients, in fact, several patients have received plasma therapy, the preformed antibodies from another patient's plasma. Can they take the vaccine? And here the rule of 3 months definitely applies, that if you have been given either artificial antibodies, which we call monoclonal antibodies, or if you have received a plasma therapy from another recovered patient, then certainly you have to wait for 3 months. So clearly you cannot take for 3 months. That's the scenario which you should remember. Can I prepone my second dose? So first of all, let us know that what is the current regime at the moment. For Pfizer BioNTech, the doses are given first day and 21st day. For Moderna, it is first day and 28th day. For Sinopharm, it is first day and 21st day. And for Covishield AstraZeneca, it is first day and 28th day. So these are the time schedules. Having said that, if 4 days overlap plus and minus is perfectly fine and it is allowed. So if for some reason, suppose you have an emergency travel and you have a scheduled date during that time and you want to take a day or two before, you can certainly take it. We don't interfere with the regulatory authorities' regimes, and if they deny, it's fine, because it is their work how to manage the things. Yet there is no absolute contradiction, there is no harm if you prepone it by 4 days. The similar question was, can I postpone my second dose? So my answer is again yes. you can postpone by 4 days easily. And if need be, you can postpone it indefinitely also, and you can take at any other time. So the next question is, I got exposed to a positive patient after first dose. What should I do? So Chavi, what would you suggest a patient?
So if you're
After
exposed to a positive,
yes,
yeah, it's the same
yeah,
thing because until you take the second vaccination, you are not 100% protected. So you should treat yourself like a regular exposed patient. You have to go for your tests and you have to see the positivity of the RT-PCR and get treated just like any other patient who would have had who would not have had the vaccine.
true. But now the question comes, can he take the second dose?
Well, if he has not had he did not acquire the infection, Brajesh, he can very well
Yes,
take the second dose. But if he acquired the infection, then we might have to wait.
correct. So
Maybe because most
it
of the
means,
vaccines,
yes,
except the
yes,
mRNA vaccines, they actually give
yes,
you a window of 4 to 12 weeks of the second
yes,
dose. It's not just
correct.
fixed 4 weeks. So you anyway
Yes.
have a leeway to 12 weeks. So even if you acquired it, you could wait for another 8 weeks and then get your shot.
So one of the advices could be that before the second shot, you can make sure that you are not PCR positive. You can do a
Absolutely.
PCR, and if you are negative, then you can very well go ahead and take your second jab at the right time, or you may even delay it.
If you're positive, then you delay it. Yeah.
Yes, yes. So I became COVID positive, not just exposed. What should I do with the second dose? So this is the answer, that if you are COVID positive, you wait until you become negative. Am I correct? And then you take your second dose, even if it is delayed.
Yes.
That is the answer. But do not take while you are still positive. This will
You
be,
will be making antibodies. You will, most
yes,
95% of patients who
yes,
had been COVID positive, they
correct,
make certain antibodies. So you
yes,
are very well protected. There have been data by every scientific academy of the world which says you can be safe up to 3 months. So you have to know that you are
true,
safe. And you can always take the vaccine 8 weeks from the time that you
true,
acquire positivity.
correct. How long will I be protected after 2 shots? So that's a question which is not, the answer for which is not yet available. Scientists do not know. There has not been enough gap from the second shot onwards, even in the trials. The maximum data we have is for 4 to 6 months. So clearly, we do not know how long will you be protected. As a general rule, at least people predict that 6 months should be a good enough period to give you protection after 2 completed uh, shots of vaccines. And the next one is similar question, when will I need a booster after 2 completed shots? So again, the answer is not known. And this will be coming after a few months when more and more people have completed an observation period after second shot. And when this period
Or
exceeds
newer,
6 months, 1 year, yeah,
or if we find some newer mutations that are not entirely covered, just like how we find every
absolutely.
year with influenza,
Sure,
viruses do mutate. So we might find that we will incorporate the newer mutations into the every year
true,
as we develop the vaccine. So we'll find out more.
absolutely. That's right. So the answer is, for last 2 questions at this point, are not definite and not easy to be given. And the next one is, should I check my antibodies to make sure the level of immunity? My answer is no. The guidelines and the authorities do not suggest to do a routine antibody test. And although there is a correlation of having antibodies and protecting yourself, but people have also reported, and the guidelines have, and the trialists have also reported, that even though your antibodies may not be looking enough, but you will still have a good level of immunity and good level of protection. So antibodies are not directly proportional to the amount of immunity and amount of protection you are going to get. So routinely, it is not advisable to check. Maybe the guidelines will change after 6 months or 8 months when there is a need for booster, and if we have to classify the people who should be given a booster and who should not be given a booster, there may be a time, but at this point of time, it is not recommended to routinely check your antibodies after 2 shots of vaccine. Next question, Shavi, can you answer this?
Again, as of now, the answer is no. A fully vaccinated person after about the week of the second vaccination should be in mostly protected, and all vaccinations are claiming very good efficacy, so should not get infected as of now. Don't take my word, because there are mutations in this virus that are happening, and then we might have a mutation which might not. Most mutations still now which have happened in the virus are responding to the vaccinations that we have in the pipeline. But we never, that is why the studies are further needed. It's still very young, the treatment and this virus. So the answer as of now will be no.
Yes, so answer is no, and there is nothing 100% in medicine. Secondly, even if people got infected during the trial after vaccine, they were either asymptomatic or they were mildly symptomatic per se. They didn't find any person severely symptomatic or severely suffered, even if he got infected. So that's a situation at the moment. In one of the trials with the Pfizer vaccine, when they tested the patients at 21 weeks, patient was given first dose of vaccine. At the second dose, prior to giving the second dose, all asymptomatic people were tested for COVID PCR. So out of those asymptomatic patients, the 20% were positive, who were, so I'll present it differently. So 3 times more who were positive who were not vaccinated versus the one who were vaccinated. So finally, it is still gave an assurance that even if asymptomatic infection can occur, but it is 1/3 less common as compared to the vaccinated people. So we should not go by the absoluteness of the efficacy. We should go by the relative uh, efficacious advantage of taking the vaccine. Can a fully vaccinated person transmit infection, an asymptomatic carrier? Again, the answer is yes. Theoretically, it is possible. It can happen. It does happen. Yet, this is one of the ways actually to protect the person-to-person transmission, and this is like a blockchain. So theoretically, it is possible, but it is far less common to transmit infection from an asymptomatic, fully vaccinated person to another person. That is why we say that even if you are fully vaccinated, you have to keep all the precautions and all the guards on like before. Do not let your guard be loose. So that is why the answer to the next question is has already been given. After full vaccination, can I get rid of mask and other protective measures? As of now, the answer is no. You should not and you cannot, because you can still harbor the virus and you can still transmit asymptomatically to other people, and you may not be even aware of it. And the next one is, my grandfather is a heart patient and is 85 years of age. Should we give him the vaccine? This is a very common question which I keep hearing time and again. So answer is yes. In the trials also, there was the lower age limit, but there was no upper age limit. So in Moderna vaccine, 18 years, and Pfizer vaccine, it was 16 years and above. So we can say you should give to below 16 and 18 at the moment, but upper age limit was not defined. And in fact, these are the people who are more vulnerable with the COVID. So obviously, they should be vaccinated. Can children take the vaccine? I'm 100% sure that in the coming future, yes, children must be protected as well. And since the trials did not include children, they were all fast track trials. They did not include children during the trial. So as of now, the recommendation is based for 16 and above or 18 or above. These are the two categories from different vaccines. How about pregnant and feeding ladies? Chavi, can you take on this?
Yeah. So the guidelines for both pregnant and feeding ladies, there has been one article, again, it's a very young, there were none of the clinical trials were on pregnant ladies and feeding ladies. Only a recent article in JAMA, which was published, which talked about pregnant women and the mRNA vaccines, and were found that none of them or the fetuses were affected. But it is again very early. So every guideline for many of the CDCs or ICMR is to avoid using vaccination in pregnant and lactating women as of now. It might change in the second quarter and the third quarter as the reports start coming in and more people are being studied on. But as of now, this is the guideline.
Yes, thank you. But there is no reason why they should not be. And we know that COVID infection, if pregnant women suffer from COVID infection, they suffer more seriously,
Yeah.
and even they can affect the fetus. So guidelines are eventually going to change, and it will be prudent to give vaccine to the pregnant ladies as well as the feeding ladies.
The JAMA article does show that there was no adverse effects whatsoever.
Correct.
So I think, but again, none of the organizational agencies have taken that up and given a guideline to be used.
Right.
But we will have it in near future.
Absolutely. The next two questions are kind of similar question, that people are on immune suppression therapy or steroid therapy, and can they and should they be given vaccine or no? So remember that the vaccines which are either live vaccines or which are viral vector vaccines should not be given to immune suppressed patient. So meaning thereby for COVID-19 at the moment there is no live vaccine anyway available. So that question goes out. But AstraZeneca Oxford vaccine is a vector vaccine and one has to be careful. On the other hand, messenger RNA and killed virus vaccine like Sinopharm and Sinovac, and even the one which is coming in India is Covaxin, they can be given, and rather they should be given because even those patients are more vulnerable to acquire the infection of COVID as well as to have more serious implications of the COVID infection. So if any other comment from Chavi, it's most welcome in this regard.
So just want to clarify the AstraZeneca point here. So even in the AstraZeneca, that the viral vector that they have used is actually modified, so it cannot replicate in the body at all. So there is replication is absolutely not possible. So actually, the guidelines for even the AstraZeneca that I'm aware of is that it can safely be utilized and it will not cause any issue in the immune suppressed patients. And so these vaccines are very safe. The response that will be generated in an immune suppressed patient will be moderate or mild. It won't be as good as an immune response in a person whose immunity is unaffected or does not suffer from an immune suppression syndrome. But vaccines are advisable for people on steroid or on immune or are immune.
Yes. So in general, the verdict is yes. Yes. They should not be denied the vaccine.
Yeah.
So the next question is, one patient said, I'm suffering from fever and headache for a few days, tested COVID negative. Can I take the shot? So the answer is, whenever you are suffering from any acute illness, do not take COVID vaccine, even if you are COVID negative. So avoid taking COVID vaccine when you are actually ill you are acutely ill. On the other hand, if you're chronically ill and you're on medication, you can go ahead and you should take the vaccine. So there is another interesting question which people keep asking, that I had first dose of a vaccine. Can I take second dose of another vaccine? The answer is no at the moment. It is not been studied. It is not been recommended. So please follow the one which you have taken the first, and then you take the same one. Having said that, there are some reports where people given two different types of mRNA vaccine in US. That was absolutely fine. And the authorities and researchers thought that it's absolutely fine. They are both are mRNA vaccine, but they have not routinely recommended. For certain reasons, a few patients had to take different vaccines at first and second ones. But in general, do not change. I have completed 2 doses of a vaccine. Can I have another one in the future if need be. What do you say, Chavi?
Right now, the guidelines are 2 doses of the vaccine. Okay. And as we go further into the next third or fourth quarter of this year, there will be guidelines on the mutations, or are they developing a newer vaccine for COVID, just like we do for influenza every year. And at that time, you will be made aware if you will require a newer or the new strain COVID vaccine when it comes out. But for now, only 2 doses are recommended, not more.
So that's the answer. And in the future, certainly one can change the vaccine depending on the situation. So there's no complete nana that once you have taken this particular type, so forever in your life you have to take that vaccine only. So you can certainly take the other one later. These are the last set of questions related to this. Will I become infected with virus by vaccination? Absolutely not. In the US, both the vaccines are messenger RNA vaccine. Then AstraZeneca vaccine is a viral vector vaccine, which doesn't replicate, as Dr. Chavi just explained. And the third one, which we have, is Sinopharm, is that group. These are inactivated and killed virus. So you are not going to get infected with the virus by the vaccination. None of these. Will I test positive for COVID after vaccination? No. Your RT-PCR will remain negative. You cannot be falsely positive. If you are positive, it means you are truly positive, but you can't be falsely positive after vaccination. There is very interesting concept and very interesting argument by some people that mRNA vaccines can change our genetics. This is absolutely rubbish. Messenger RNA vaccines do not enter actually in the nucleus of the cell. They just enter in the cell. They only, like any other messenger RNA, they only give instructions to make a protein which is similar to the protein, right?
Yeah.
So do not worry about the mRNA vaccine that it in any way it can affect our genetics. So there could be more questions which in the chat box, but before that, I'll just conclude by giving a few more insights, some final slides of the presentation, and then we will, if time permits and if people are still patient enough, we can continue for another 15 minutes and take on some questions from the audience. So COVID-19 vaccination will help protect you from COVID infection. It will help create an immune response in your body against the virus. It may help keep you from getting severely ill, even if you do get COVID-19. So at least there is some advantage, if not 100% advantage. You can get infected, but even if you get infected, the illness will not be severe. And you can also protect your family, your co-workers and patients. In fact, this is your responsibility to become a barrier and a blockchain in the process. If you get vaccinated, at least you block the virus transmission at some stage. So this is also a responsibility towards the community to get yourself vaccinated. It is one measure to help stop the pandemic. While COVID-19 vaccines appear to be effective, additional preventive tools remain important to limit the spread, and we should not forget that we don't have to let our cards loose at this moment, even after vaccination. It is a safer way to build protection. People think that, oh, let me suffer and I'll have some natural protection and that will be better immunity. The answer is no. Getting the virus that causes COVID-19 may offer some natural protection, which is immunity. But first, we do not know how long this protection lasts. And second, the price is very high. The getting a severe illness or possibility of even a death, it far outweighs any benefits of natural immunity. So we should not depend. We should not ask for a viral infection just to get the immunity. So vaccination will help protect you by creating an antibody response without the risk of severe illness. So, and then the last question is, once again, I'm raising it because people have lots of doubts of safety about the vaccine. In our common practice, because now in UAE, we have more than 2 million people who have been vaccinated. We didn't find any of the serious problems with the vaccine. They are all safe. And similarly, in the last trials, which were done by Moderna and Pfizer vaccines, both included almost 40,000 patients. there were hardly any safety concerns. There was hardly any big side effect. So with this, I have completed the presentation part, and we can look for some. Oh, I see 73 chats. So there may be lot many questions here. So Shavi, I will need your help also. I'll keep reading some questions and we'll keep answering whatever we can do quickly. I am a vitiligo patient and would like to know if I am eligible to take the vaccine. Answer is yes, certainly you can. Then, thank you, Dr. Mittal, for a very interesting presentation for the sharing the information. Okay. Uh, thanks, Dr. Mittal. As I'm already, somebody has written, as I am already on medication and I had a heart surgery and got 3 stents, should I go for vaccine or wait? In our presentation, we already clarified that everybody can be vaccinated. There are very few rare circumstances where we suggest not to get the vaccine. So in general,
Brajesh, do you
yes.
want to talk about
Yes.
blood thinners and the vaccination?
Of course, yes. So that's a good question. So blood thinners per se by themselves are not a contraindication to vaccine. Only thing to remember is that those who are on oral anticoagulation, they can have little more hematoma, means little more swelling at the time at the site of
Right.
injection. Make sure that if they are on warfarin, their INR, they are all aware what is INR. So their thinning level should be well balanced and well maintained. If it is out of the range, then they will have much more chance of it. But those who are on any blood thinners, anyway, time and again, they get intramuscular injections. So it is the same thing and the same risk as what you might have with any other
So there's a
intramuscular
lot of
injection.
talk about, as a
Yes.
physician, a lot of my patients are asking. So there was a couple of chats here which I read about
Yes.
ecosprin. So I want you to clarify that very clearly to everybody. Ecosprin is
Yes.
not a contraindication. So there is a lot of couple of really
Yes.
long chats on ecosprin. So you
Yes.
can
So
probably
certainly
mention.
you can go. One can take, no problem in that. With keeping this in mind that there can be a little more chance of having hematoma.
Hematoma.
And that can
Yeah.
be resolved easily by cold compresses and analgesics and
Absolutely.
anti-inflammatories. Yes. What if you accidentally get COVID in the vaccination period of 21 days? We have already answered. If you're actively suffering, then delay your second dose. If you have recovered well and if you're COVID negative by PCR, you can take your vaccine. Or you can delay also slightly until you become completely negative. If someone is allergic to eggs, which vaccine he should take? So the answer is
Any of
you
the
can
above.
take any vaccine, any of them. True.
None of
So
them
I
are
will
bad.
just extend the question a little more. If somebody has a lot of tendency for allergies, can he take the vaccine or what precautions he should take? So the answer
I
is
think, go ahead.
yes, yes. Okay.
Go ahead.
So the answer is that whatever allergies you have, it does not tell you exactly that this vaccine will also cause you allergy. It is an independent thing. So we suggest that if you have only mild allergies or no allergies in the past, you wait only 15 minutes after the injection. If you have been having a tendency of having several or moderate to severe allergic reactions in the past, you can still take the vaccine, but you wait for 30 minutes after the injection. So make sure that there is no serious allergic reaction at that time. And the third point is if after the first dose of vaccine you get severe allergic reaction, then do not go for the second dose of the same vaccine. So this is the dictum at the moment. So routine allergies do not preclude you or do not stop you from taking the COVID vaccine. Somebody has written to me, have come across cases regarding Pfizer one having serious side effects with heart patients. How far is it true? It is not true. So we completely deny this. It has not been reported. It has not been seen. Another person, I went for vaccine, but was asked whether I have hyperthyroid. Then I was told not to take the vaccine. Uh, as per our available knowledge, there is no real medical contraindication to carry out the vaccination program, and everybody can get the vaccine, barring a very few circumstances. Hyperthyroid doesn't fall into that group. What happens if you are diagnosed COVID positive 10 days after you have taken the first dose? We have answered this question twice, and I think the answer is very clear. Some people became positive after taking vaccine. Is this normal? So they are positive not because of the vaccine. They may have acquired infection before the vaccine actually started working, right? So, so don't consider that vaccine caused the positivity, not even the false positivity. Chronic cases of rheumatoid arthritis and such cases are on steroids, methotrexate. Are they advised to take vaccine or to stop during 2 days, 2 doses of 3 weeks? We have already answered this question as well, and we do not suggest to stop unless it is absolutely necessary, unless somebody is very much suppressed, because then the vaccine will not be effective. It will not give you enough immunity. And if it's possible only, then stop your immunosuppressant. But immunosuppressed patients, in fact, need more coverage by the vaccine than those who are not immune suppressed. So they should continue. Should COVID survivor wait for 3 months as they develop antibodies? We have answered this question already, that yes, you can wait for 3 months, or even if required and even if needed and even if it's possible, you can take earlier than that. The vaccine can be taken even earlier. But 3 months is a period because 3 months, as Dr. Chavi already said before, that we expect that a natural immunity lasts at least for 3 months. So you can delay for 3 months. But even if you take before 3 months, nothing is going to happen. There is no harm. Then another question, post-jab, what antibody level is considered safe? How soon it is attained? And for how long it is maintained? Can I take another booster if levels aren't optimum? So the trialists say that immunity level comes between 10 to 14 days of the first shot, and it is boosted by the second shot. That is why most vaccines are of 2-shot regimen. How long the immunity lasts, we do not know. How soon it is attained, we already answered. And what level, it is not a defined level, but generally it is considered to be 3 to 4 times than the upper defined level of IgG antibodies. So up to 4 times and above you have, you can consider yourself as a protected and immunized, well immunized. Next question is, after how many weeks once recovered from COVID can I take the vaccine? We have already answered this. You can take as any number of weeks after, but 12 weeks should be a good time. If I have suffered by COVID, they said that after 3 months only. We already gave the logical explanation that 3 months is a good enough period because you already have natural immunity for 3 months. I have told of people who have taken first dose and still been infected in COVID. We have answered this. Yes, it is possible. It can happen. It can happen for 2 reasons. One, vaccine anyway takes time, 10 to 14 days to come into action. So between that, you can suffer. And also, a vaccine does not guarantee 100% immunity in any of the trials. So even immunized patients can suffer. But the thing is that if you have developed enough immunity, even if you suffer with the infection, it will be less severe and less troublesome. If one had transverse myelitis and recovered, is it safe to take the vaccine? Dr. Chavi, what do you say?
Again, the vaccine does not at any point have an activated virus. Okay, so there is none of the vaccines have a capability of replicating in your body. It is absolutely safe to take. So there is literally, what can I say? There is no contraindication while disease is concerned in taking this vaccination. At least has not been known in the academic agencies. So yeah, you can take it.
So that is the very reason we are conducting this seminar, to clear of the doubts in the people's mind and to reassure
Questions,
and reaffirm based on the scientific knowledge, not what we think and we should tell from our mind. Doctor, can I take vaccine as before 2 months I undergo angioplasty? If you are medically fine and cardiologically very stable, you can. If one had transformatis is already there, how long protection after 2 doses of vaccine? We do not know. We assume 6 months because we have data until 6 months now.
only.
And so there is one compliment also, that all my doubts have been answered. So good. Thank you so much for appreciating. Then, had mandibular lymph nodes enlarged and early morning yesterday had pain in heart too, but today don't so. I was already taking aspirin since 2 months. I don't think this is related to vaccine per se. So I will just skip this question. If a person does an antibody test and titer is good post-infection, can he avoid the vaccine? We say no, because all the trials show that after first dose, it dips down, the level dips down. So in order to achieve a sustained and long-lasting memory immunity, what we say, you have to have the second dose. Except there is one vaccine, which is a single dose vaccine, that will be live attenuated vaccine. This is not yet
Which will have so
in the
many
pipeline.
other precautions.
Yes, it has so many other negatives, but that gives a very robust immunity, and that is only once. One shot is enough, but then it has its own disadvantages, and yet
The
not.
recommendations are not to check your antibody level, and just
That's true.
because they've already done the clinical trials, they have already seen
Yes.
what happens by the first and the second dose. They are bringing it to you with a lot of study, because trust me, all
Yes.
vaccine makers would want to only give you one dose and get done with, especially in this COVID pandemic where we have to cover 7 billion people,
Yes.
in this on this earth. So when they have said you need two, they've already done their clinical studies and they're coming with you with recommendations. So
Right.
really do not check your antibody levels, because they might fall very rapidly and you do need the second booster.
That's
Recommendations
true.
are not to check it. Yeah.
And even you don't get guided by antibody testing. You don't need to check antibodies anyway.
Yes. Yes.
Yeah. If you have already taken both doses, any time limit for travel after second dose? So the answer is that even after first dose, there is a reasonably and fairly good protection, which starts at the 14 day, 10 to 14 days. So you are already somewhat safe. And after second dose, you provide extra immunity and you are further safer. Having said that, nothing is 100%. You have to take all your regular precautions as well as before, at least for this time. So,
So regarding travel, if you really want to travel and
yeah.
you want to be safe, I mean, recommendation wise, it's about 10 days after the second dose.
Okay.
Yeah.
And then will taking vaccine like Sinopharm show a positive result during swab test within 15 days? No. Swab test and RT-PCR have nothing to do with the vaccine.
Mhm.
Dr. Fauci says, somebody has quoted this, says that 21 days to 28 days after second dose, one is mostly protected and can travel with some precautions still. Of course, yes. And nobody is 100% protected even after the second dose. So, so keep in mind, there is no absoluteness here. It is only a relative thing. After first dose, you are somewhat protected. After second dose, you are more protected. But don't take it like now you are above God, you cannot suffer. It's not like this. Can people still carry virus even though they don't get affected after getting vaccinated fully? They can still be asymptomatic carriers. We have already discussed this part. After the two shots, can we still do another round? We do not know as yet. We have no answer to that. Then one person is asked, which vaccine is good for me? I have 3 stents inserted, plus I have allergic asthma. Any of the available, whichever you can get easily, you get it done. There's no relative particular indication or contraindication by any of the vaccines. If somebody has asthma or severe fish allergy, we already answered this question, that if you have serious allergies reported to you, then after the shot, you wait for 30 minutes instead of 15 minutes. Mostly, but it is not a contraindication. If VP is high, can the vaccine be taken? If not, then what is the ideal VP required to be? Everybody's blood pressure should be in the normal limits at any medical procedure. It is also an intramuscular injection. So that is why blood pressure is checked. If it is high, you tend to create more hematomas, more inflammation at the site. But it is not something which is absolutely contraindicated. Then some people become positive because of taking vaccine. This is not correct. Uh, I just got tested positive and I can take the vaccine. I just got tested positive, and when can I get? We have answered this, that you have to wait long enough, recover completely, and then take the vaccine. You can wait until 3 months.
Vijay, I think one
Yes.
more time, just
Yes.
explaining to people that
Yes.
none of these 3 line of vaccines, there is any viral replication of any kind possible.
Correct.
So you will not, what is RT-PCR? It is a nasal and oropharyngeal swab which picks up viral replicating particles and we amplify them. And that is what you see in RT-PCR. There is no replicating virus given to you, you cannot come positive in a swab. So I will keep repeating to everybody, there is a lot of journalism going around, sensationalization going on. None of these vaccines can give you an active replicating virus. So an RT-PCR can definitely not be positive because of the vaccine. It could be an infection that you might have acquired before the immunity has set in. That's it.
True, that's true. There is a question related to EcoSpin, which already, Chavi, you have answered. And then I have a Nigerian wonderful lady. So she is saying congratulations to the presenters. Impeccable presentation, Dr. Chavi, for you it is. Huh? Why is vaccination being refused if BP is high? Well, all healthcare providers follow some guidelines because they don't know all the gory details or little details or in-depth details of everything. So they follow some guidelines which is given to them, and there has to be some boundaries. So that is why it is being sometimes denied when BP is very high. I have done angioplasty 3 years back, had ablation 1 year later. Is it safe to take the vaccine? Yes, it is very safe. Whatever medications you are taking, no problem, you can continue. So wonderful explanations to each of the questions, very reassuring, thank you. Then most of them are then thank you. This question is, can a person take any alcohol after 3 to 4 days after vaccination? So what's the answer?
Dr. Mittal will answer that.
The answer is, if you look at the mRNA vaccines and if you go by the CDC and WHO FDA website, they say it is not forbidden. Okay, I'll give you the honest answer. If you go on the European side, they say it can affect the effectivity of the vaccine, so better avoid for at least a week because it can reduce your antibody formation. So you want to go with US or you want to go with Europe, you decide yourself. This is my answer. So, I was expecting this question. In fact, I should have put it in my questionnaires. So it just skipped from my mind, yeah. So, all right. Thank you, doctor. Thank you. Most of them are now thank you ones. Then, okay.
I think yeah.
Does the immunity go down after first dose of vaccine? No, it doesn't go down, it goes up. Can we have a copy of your slide? Okay, yeah. All right, so certainly. We will post it, we are recording it and we will post it in the YouTube, the whole presentation. Do we need to do antibody test? We already answered no. If there are any dietary changes after taking first dose of vaccine, or do we have to take any precautions? Nothing in particular. No specific precautions are required in the peri-vaccination period. Chris, to everyone, thank you, Dr. Mittal and Dr. Mehra, for the insights. Somebody asked about Johnson & Johnson vaccine. How does it work? Johnson & Johnson vaccine is also like Sputnik or Oxford vaccine. So it also works like a viral vector. Viral vector. Yes. Then when is Pfizer vaccine likely to open? Once the trial for the younger generation, once the trial is completed with the children. Well done. Most of the questions answered. One of the best program that I attended. Thank you, Chavi, for doing this to us. So do we have to take any precautions after taking first dose of vaccine? We already changed, nothing specific. Thank you, Dr. Mittal and Dr. Mehra, for a wonderful, comprehensive and reassuring presentation. Really appreciate it. Excellent presentation, informative presentation, dietary changes. Somebody was refused vaccine because BP was 190 by 120. Gentlemen, please control your BP first. That is equally devastating than the suffering from vaccine infection. So come back to me as soon as possible. Get your BP fixed first. Can we get a copy? Very informative, richer. Okay, so we are done with all the questions here. So ladies and gentlemen, I think it's been a wonderful journey. And as always, I keep giving talks and presentations, and the most beneficiary is always me, because when I prepare a talk and when I present it, my concepts get cleared. I'm more knowledgeable, I'm more thorough, and I become more authoritative in answering. So thank you for helping me out. Because of you people, for last 1 month, I'm getting questions right and left about the vaccines from all of my patients and patients' relatives and their friends. So that prompted me to devise a program of this kind, and that made me so much more knowledgeable, and even my concepts got cleared. Hopefully, we'll continue to do such similar programs. It is very hard for doctors, let me tell you. We do attend a lot of meetings, we do have a lot of presentations within our community. It's not very common for a doctor to prepare a talk and present for the public. It's very hard, really. So we did it. I was also supported by one friend who owns a equipment company, Life Companion, Mr. Mehmood. So if he's listening, I will also say my thanks to him for providing me some support in carrying out this educational activity. And I'm so much thankful to our chairman. He came all the way in the forum. First, he was actually not available, and he had told that he would give a recorded video. Finally, yesterday, he decided to come in person. So I am so much humbled and grateful to him for being with us. And similarly, Dr. Chavi, she agreed on a very short notice. I pulled her up, and she contributed immensely to this program by answering very, very thoughtfully all the questions with the good authenticity. So many thanks to Dr. Chavi. And we have our organizers, Shalini, has always been very supportive to me from many years for providing all the secretarial support and being the master of the ceremony. Mr. Junaid is our website designer and he helps me a lot. So many thanks to all of you. With this, I invite Dr. Chavi to also say a few words and before we part away and conclude this seminar.
Thank you, Brajesh, and for giving me this opportunity. I think, as you very rightly put in, the questions were amazing. The audience were very involved, and I'm grateful for their involvement and their interest and their questions, because when you question, my mind wants to think and explore the knowledge. So extremely grateful, and for every such chance where we get to share what we learn every day. And when you ask questions, we learn and we explore more and we increase our depth of knowledge. So thanks, Brajesh, for giving me this chance. And thank you,
It's my
Shalini.
pleasure.
Thank you, Junaid. And thank you very much for having me here.
Thank you so much. With this, we say goodbye and good night. Thank you.